Yeah, I did forget. I want to mention that we do have an outpatient program here. We have a PHP, which is considered partial hospitalization program, and IOP, which is intensive outpatient, where they can come. If they need to, they can see the doctor every day there. They do wonderful groups and individual therapy with the patients. And again, they can get the medications. And the other thing that we do is make sure that we don't want anybody to run out of their meds. That's probably the number one thing that we want to avoid happening, because then they end up in the hospital, or they end up hurting themselves or others. So having their meds. So when we do a discharge, since COVID has started, we will do. We don't usually do a refill, and instead of a 7 or 14-day supply, we're giving them a 30-day supply with a refill. To make sure.
So what do
that
they do after that?
Yeah, well, that's the issue. Is we try to refer them to our PHP or IOP, or whichever. We check with their psychiatrist. If they have an outpatient psychiatrist about what are we going to do, but we're going to make sure that they're not going to be without meds.
I think the one client I'm thinking of, it went to some place such as that, and I don't want to put the place I'm not going to say where, but in Clearwater, local, and they gave them the one refill. Their psychiatrist, I think, got sick and with the COVID or something, and they gave them the 30-day supply, the refill, and then their main doctor is out of business right now for whatever reason, and their primary care physician won't fill those kind of meds, and so this person is out of luck, that doesn't know, and basically a new intake with a psychiatrist is 3 months away. I don't know, some of them it takes a very long time to be seen as a new patient, so they're at the brink of being Baker-acted if they can't handle it long enough until something normalizes. That's really sad. Hey, but Kim, we got to take a break, and we're going to take a commercial break, and just hang tight, and we will be back with Moments of Clarity in just a moment. Stay tuned.
You're listening to Moments of Clarity with Tiffany Werner. We welcome your input at 866-826-1340. Tiffany will be right back after this.
This is the Tan Talk Radio Network.
Do you ask yourself any of these questions? Will I ever be able to get out of debt? Will I ever be able to retire? How am I going to pay for my children's education? How do I begin saving for my family's future? And if something were to happen to me, will my family be taken care of? Have you struggled in finding the answers? Forever Forward Financial can help answer these and many more questions about your financial future by teaching you how money works, by providing you the financial education you seek, by assisting you in making the right retirement or educational decisions that are best for you and your family, and by helping you take the necessary steps in establishing and meeting your financial goals. Please call us today and schedule your complimentary, no-obligation meeting to discuss your needs and concerns. The number, 727-422-7761.
Hi, this is Tiffany Werner, your host of Moments of Clarity. Living with a mental health disorder is not easy. If you or someone you know are struggling with this, please know it's so important to seek treatment, and I'm here to help. Please visit the website at momentsofclaritywithtiffany.com to view blog posts and resources on this site to help educate and inspire you to take action, because there's no shame in seeking help for mental health. While you're there, please take a few seconds to sign up for my email list. You'll get some extremely valuable educational and entertaining content that can be sent right to your inbox each week. Plus, you'll also get instant and free access to my guide on managing your anxiety. You can also follow me on Twitter at MOC with Tiffany and at Facebook at Tiffany Werner. And once again, the website is momentsofclaritywithtiffany.com. Thank you so much for your support and for listening to your show, because change can only come when we stand together as one.
This is the Tan Talk Radio Network.
We are back to Moments of Clarity with Tiffany Werner. To join in the discussion, call 866-826-1340. Now, here's Tiffany Werner.
Hi, and welcome back. Hi, welcome back, and this is Moments of Clarity. My name is Tiffany Warner. I am a licensed mental health counselor, and I'm your host. And my guest today is serving on the front lines in residential mental health community, one of the sponsors of Moments of Clarity, Win More Healthcare. And we really got to pay a tribute to those that are working in hospitals and the front lines and wearing masks and being in residential population, really putting themselves out there while a lot of us are quarantined at home and trying to stay out of the way, 6 feet away from everybody. And I really have a strong heart and a soft spot for people that are just really putting themselves out there and really trying to get a hold of this pandemic and risking their lives, basically. And so one of the sponsors of Moments of Clarity, Win More Healthcare, and a licensed clinical social worker. So she didn't really sign up for this, but she's in the lineup. I have a lot of respect for her, and I want to welcome back Kim Trainer. Hi, Kim. Thank you so much.
Thanks, Tiffany.
And I mean what I say. When you just, we go to school for social work, psychology, all this, and, it's kind of the same but different. But at the same time, we don't sign up for residential and pandemic and health and masks and all of that when we get into counseling to mental health, help people. This is surreal for everybody, but I really want to give props. I want to give props to the mental health community. I mean, you're in residential, and I'm sitting there whining because I'm doing things through telehealth or virtually, and I'm complaining from being in front of the screen too long and mentally drained, and you're actually physically putting your life in danger as well. So it's some of the things that we don't sign up for, and I just want to give you props and commend you for that. I applaud you. Thank you so much for all you do.
Thank you, Tiffany. We appreciate it. And literally, you know what? We know we don't get into this field for the money. We know that.
Right?
It's more of a calling. Yeah, it's definitely more of a calling.
Yeah, you make me laugh because my student loans aren't going to be paid off till 2032.
Right? Yeah, that's what I think. I'm going to be paying it with my Social Security check. That's what I've said. Okay, I guess.
I think that's a mental health joke, but sorry.
Yeah,
you get a tickle spot.
Absolutely true. Yeah,
totally.
But we do it because it's in our heart.
Right.
We had family members. We're called to this field. It's definitely not a choice.
Right.
And I'm amazed. Here's what I get to see every day. I get to see mental health techs, nurses, dietary, housekeeping, business people, administration. They all come every day, and really, they don't have to. I mean, again, it's a calling, but they're here, and they don't complain. They don't vent. It's like, yep, this is what we're doing, because we can't imagine not treating patients, no matter what's going on. You can only, I've been surprised at some of the stuff that we weren't able to think about. I went, wow, I would have never thought about that. Like how the pandemic has affected the mental health treatment, and I'm like, wow, I guess we got to think about that now. So like on our
so glad
unit,
you brought that up.
Yep. Yeah. Literally okay. And every day, we never know what's going to happen, and every day we're on a call with other, agencies and other hospitals, and okay, now we got hit with this, and now it's another thing, and then it's like, we don't give up. How do we do that? We can't possibly give up. There are people, they're human beings, and we treat human beings. So our nurses, no matter what, like in the beginning, we hadn't gotten our orders, and we didn't have enough PPE, and we knew that we were going to run out. I think we had, at the time when we figured it out, we had about 10 days left.
PPE meaning protective equipment,
right? Personal protective equipment. So that would mean the masks, the gloves, the gowns, the visors, the shields.
Universal precaution stuff that we're usually supplied with residential. I've worked with residential for years. So I understand what you might be going through on like the average day, I guess, but not during COVID, for sure. Honestly, the worst thing I experienced was a rat infestation or whatever. It's a whole different story, but this is different. And universal personal protective wear, well, going into, I'm trying to put this for the listeners in a perspective here. This is a enclosed hospital, not medical, but mental health. And so they do have nurses and psychiatrists that treat the patients, but for the most part, these people going in there are in there for inpatient treatment to recover for severe mental health stuff, mental health disorders or illnesses, or to try to stabilize and get the right medications. And it's when they've, basically all the other options have been exhausted. So what Kim's doing here is what saving lives like usual, but then having to learn all of this medical terminology and equipment on top of that as a licensed clinical social worker.
Correct.
So I just want people to understand it like as it is, because unless you kind of see the clear picture, I don't think people would understand exactly how hard and how fascinating it is for what you have to do every day and how you had to adapt.
Yeah, it's been amazing, but I love to watch how everybody steps up and we do the work. We do it. Well, I have a recreational therapist. She's a CTRS, a certified therapist for recreation, and literally she came up with. She was on her 2 days off. She made 400 masks for our patients out of that heavy duty auto shop paper towels, the blue.
Yeah.
And you know what? They're actually probably a better grade than our surgical masks, because it really does stop a lot of stuff from coming in, and the patients loved it. So, there's where people, our humanness comes out, and
yes.
Our calling comes forward, and we just keep doing it. So we were trying to figure out ways to save the surgical masks, like wearing them and then letting them dry out in brown paper bags. And, we have one of the staff members that was using, I think it was that Instapot to dry them out so that she could use it. Desperate times call for desperate measures. But we're not going to deny somebody the right to access to care.
Right.
We're just going to figure out a way that we can do it and keep them safe and us at the same time. So on the units, what we've done is, we have that behavioral health furniture. So we've gone up. I brought the maintenance guys up to every unit, and literally we pulled some chairs away and just took them out of the day room so that every chair is at least 6 foot apart so that we can practice the social distancing on the unit. So there's all kinds of, the other thing was the elevators going down to the dining room. So we had to use extra staff to take, less people in the elevator. And when they're in the elevator, they wear their masks because they're in a very small area, and they go down to dining. So as long as we can keep doing that, the rec therapist and the therapists take them outside as often as we can, because we don't want them to feel like they're prisoners.
And especially those that are actively suicidal can't be unsupervised.
No.
So someone's going to be with them, and probably hard to be 6 feet away. It's hard. That becomes the issue. Yeah. Right.
We have a couple of patients. We have I think 4 right now that are on what we call a BA8, where they've been severely psychotic and unstable and a harm to themselves or others, that we've taken them to court, and they're slated to go to the state hospital because they really need a lot of time away from public, and state hospital's not accepting anybody right now. They're shut down. And then we have ALS.
I swear I used to work, Kim.
Yeah.
I've worked there.
Yeah.
And the people that are actively suicidal, they'll be very creative. If they really want to do something, you really got to watch them. I mean, you could clear a whole room out, and they'll take the plastic knob off of a curtains that that when you blinds, that you turn, you twist, bite it off, and start cutting themselves with that. I mean, it's some people really need protection from themselves at times. Yeah, and
Correct.
it takes